The NCLEX exam is a critical milestone for aspiring nurses, serving as a gateway to the rewarding profession of healthcare. With a recent update incorporating case studies, the exam's complexity has increased, challenging candidates to demonstrate not only their knowledge but also their clinical reasoning skills. Navigating this new terrain requires a strategic approach that combines solid foundational knowledge with effective problem-solving techniques. In this article, we will explore tips for passing the updated NCLEX exam, including real-life examples from recent questions. Master the basics. While the new NCLEX may incorporate case studies, the fundamentals remain essential. A strong grasp of core nursing concepts and principles lays the groundwork for success. For instance, consider a scenario involving a patient with heart failure. Despite the case study format, you would still need to recall the signs and symptoms of heart failure, its underlying causes, and appropriate interventions. Practice clinical reasoning. The case study format challenges your ability to apply theoretical knowledge to real-world scenarios. Develop your clinical reasoning skills by regularly practicing case studies that mimic the exam structure. For example, you might encounter a case involving a patient with diabetes and be required to prioritize interventions based on the patient's condition and needs. Prioritize and delegate. Effective prioritization and delegation skills are crucial for nursing practice. The updated NCLEX may present scenarios where you need to determine which tasks to address first and what can be safely delegated to other healthcare team members. Imagine a case study involving a busy medical surgical unit where you must decide which patient's needs are most urgent and which tasks can be assigned to nursing assistants. Utilize critical thinking. Critical thinking is the cornerstone of nursing practice. Approach each case study question thoughtfully, considering the implications of each option. For instance, you might encounter a case involving a patient experiencing respiratory distress. Instead of simply selecting an intervention, critically analyze each choice's potential outcomes and select the most appropriate action based on the patient's condition. Practice time management. Time management is crucial during the NCLEX. While case studies may require more thorough analysis, ensure that you allocate sufficient time for each question without getting stuck. Imagine encountering a case involving a patient who requires multiple medications and assessments. Practice managing your time effectively to ensure that you complete all tasks within the allotted time frame. Stay updated. The field of healthcare is dynamic, with new research and guidelines emerging regularly. Stay updated on the latest evidence-based practices and guidelines. Imagine encountering a case study involving a patient with an infectious disease. Being aware of the most current recommendations for infection prevention and control is essential for making appropriate clinical decisions. Review pharmacology. Medication administration is a significant aspect of nursing practice. Study pharmacology thoroughly to understand drug actions, interactions, and adverse effects. In a case study involving a patient who is prescribed multiple medications, your knowledge of pharmacology will guide you in identifying potential risks and benefits associated with each drug. Simulate real experiences. Seek out simulation scenarios or case studies that closely resemble real clinical experiences. This will help you acclimate to the case study format and simulate the decision-making process you would use in a real clinical setting. For example, a case study involving a patient who has just undergone surgery will challenge you to consider post-operative care and potential complications. Collaborate with peers. Studying with peers can be invaluable. Collaborative learning allows you to share insights, discuss complex scenarios, and consider different perspectives. Imagine discussing a case study involving a pediatric patient's unique needs with your peers, benefiting from their diverse viewpoints. Stay calm and confident. Test anxiety can hinder your performance. Develop relaxation techniques and positive affirmations to manage stress. When faced with a challenging case study involving a critically ill patient, maintaining composure and confidence will enable you to make rational decisions under pressure. The updated NCLEX exam's case study format reflects the dynamic nature of nursing practice, requiring candidates to blend theoretical knowledge with clinical reasoning skills. By mastering the basics, practicing clinical reasoning, honing time management, and staying updated, you can approach the exam with confidence. Incorporate real-life examples from recent questions to solidify your understanding and prepare for success on exam day.
Patient scenario. Emily Johnson, a 32-year-old pregnant woman at 36 weeks of gestation, is admitted to the labor and delivery unit with vaginal bleeding. She reports mild abdominal cramping and a sensation of constant tightening in her lower abdomen. Fetal heart rate monitoring shows variable decelerations. Her vital signs are stable. Question 1. Some text goes here. What is the priority action for the nurse to take after noting variable decelerations in the fetal heart rate on the monitor strip? Some text goes here. A. Administering pain relief medication to the patient. B. Placing the patient in the Trendelenburg position. C. Changing the patient's position to her left side. D. Providing the patient with oral fluids. Answer: C. Changing the patient's position to her left side. Explanation: changing the patient's position to her left side can help improve blood flow to the placenta, potentially alleviating cord compression causing the variable decelerations. Question 2. Why is continuous fetal heart rate monitoring important for a pregnant woman experiencing vaginal bleeding and abdominal cramping? A. It helps to identify maternal vital signs changes. B. It assesses the mother's level of discomfort. C. It provides information about the uterine contractions. D. It evaluates fetal well-being and distress. Answer: D. It evaluates fetal well-being and distress. Explanation: continuous fetal heart rate monitoring provides crucial information about the baby's response to contractions and helps identify signs of fetal distress due to compromised oxygen supply. Question 3. Which intervention should the nurse anticipate if Emily's vaginal bleeding and fetal heart rate patterns do not improve? A. Discharging the patient to home with bed rest. B. Administering tocolytic medications to halt contractions. C. Preparing for an emergency cesarean delivery. D. Providing the patient with oral antibiotics. Answer: C. Preparing for an emergency cesarean delivery. Explanation: if the fetal well-being is compromised and interventions fail to improve the situation, an emergency cesarean delivery might be necessary to ensure the safety of both mother and baby. Question 4. What information should the nurse include when educating Emily about variable decelerations in the fetal heart rate? A. They are typically caused by normal uterine contractions. B. They are a result of fetal head compression during contractions. C. They indicate increased fetal oxygenation and well-being. D. They are usually benign and require no intervention. Answer: B. They are a result of fetal head compression during contractions. Explanation: variable decelerations often occur due to compression of the umbilical cord by the fetal head during contractions, potentially compromising oxygen supply. Question 5. Emily asks the nurse why she is feeling a constant tightening in her lower abdomen. What is the nurse's best response? A. That's a sign that your baby is engaged in the birth canal. B. It's common during the third trimester due to Braxton Hicks contractions. C. You may be experiencing normal stretching of the uterine muscles. D. This could indicate that you're in active labor. Answer: B. It's common during the third trimester due to Braxton Hicks contractions. Explanation: the constant tightening sensation is likely Braxton Hicks contractions, which are normal in the third trimester and help prepare the uterus for labor but are not indicative of active labor.